Can you see my presentation?
Not it.
Okay, sorry. Let me share again.
Yes, we can. We can.
Okay, okay. So this was titled as false passage for the presentation. So I would label it more as a missed passage during a smile procedure. So this is a video that we had presented a few times in different conferences. I'll be taking you through this case. So this was titled as Restoration of Smile at that point of time. And because I think we had a few videos of smile, I thought like I'll take you through how a smile is done with the help of animation, where you have the posterior and anterior dissection planes in the cornea, and then you go ahead and separate the anterior and posterior cleavage planes with the help of a spatula. In the animation on the right, you can see how these are separated, and then you remove the flap, the lenticule. So this was a patient, 26-year-old patient, moderate amount of myopia, and topography is pretty regular and suitable for a smile procedure. So he underwent a smile here. This is the patient's eye. So on the right, you see how the dissection has been done. And you have two animations running. And here you have the posterior dissection done on the anterior cleavage plane, and then the side cut you see. And then here you see we go ahead and then we try to separate the anterior plane and the posterior plane separately, and then try to dissect the planes completely before we remove the lenticule. So this was the first eye of the patient, wherein things have been going pretty well so far. And this is the second eye of the patient. So here the dissection has been done, and then you can see the surgeon going ahead and trying to reach the planes. So the surgeon tried to separate one plane, and then now not able to find the second plane. Okay, and we went back and looked at the video now. So if you look at, the surgeon went in the center, and he assumed that he went in one of the plane, and then he went in the periphery, and he tried that. He assumed that it was the second plane, but it was not. He was not in the one single plane only. And when we looked at the slit that is available, we could not make out. And later, it was a second surgeon who seeped in into the surgery and trying to figure out what has happened. So after looking at all slit lamp examination, everything, we figured out that the anterior plane was not dissected. So we started off from the periphery, trying to pointed the dissector towards the cap and trying to delineate the edge. You can see the fold in the edge. So here, as we go, we can see a fold. Once you have this fold and trying to separate it from the cap, it's pretty difficult. So we're trying to separate it, and since it's folding on its own, trying to separate it with the blunt spatulas, like it would be a little difficult. So here you can see a folded lenticule where it was trying to fold on its own, and we tried with the forceps as well, tried to peel this off. So it was not possible. So later we had to resort to taking a slightly pointed dissector and then enter into the anterior plane, that space between the anterior surface of the lenticule and the posterior surface of the cap. And this was helpful for us. And then later we were able to separate it completely and pull it out. So we did see a tear in the cap, but postoperatively, to our surprise, patient's visual acuity was very good. So I think some tips I can give here is, whenever you have a patient with smile, I think it's very ideal for us to get into the right planes of these dissections. So first step is going from the periphery and entering into the anterior cleavage plane is important, and then you go posterior plane in the second, on the right of your incision, and then see that there's a resistance in between. And then there's a slit sign when you separate the tension on the lenticule. And once you try to lift the lenticule, you can see a tenting of the lenticule. So when you have achieved that, I think dissecting in both anterior and posterior planes would be very easy. And also, always remember that to do the complete dissection, leaving the peripheral adhesions, because once you remove these adhesions, the lenticle will start folding on its own. Whenever you cannot make out what you have done, I think one of the method we found is putting prednisolone in the interface would help visualize things better. So I would say like SMILE is a very successful, safe and predictable refractive procedure once you understand every step involved in this procedure. So that's what I had, Deepthi, for this case. So I think Dr. Rupal can add more to this.